where a question comes your way, you're not sure what the answer is, you can just either put it to somebody else, or just, be honest, at this point in time, we don't know what to do. So, I'm not sure.
Not sure, but I believe
No.
Okay. Good to know.
No, we were not involved. Yeah.
Which one? Which guys? Ronnie? Yes. Which guys does us go to which people are supposed to start talking? Because now he doesn't want to talk, but he doesn't know. He's not indicating.
One question.
No, tell control room. I don't have my mic on. Tell control room. Who do they want to start talking? Because he's saying some of the people to start talking, but he's not saying. But it has to be supported.
Just in general, check sound.
So it's just general talk.
Do you have your earpiece in?
One chair should get out.
1, 2, 3, 4, 5, 6 on the podium.
No, wait, Mr. Shapumba.
What's that?
Mr. Shapumba.
Maybe we should read his questions and be prepared. I did not even.
You have them on your phone?
I have them on my phone.
Okay.
Here's the first question. Number 3, it's a ministry question, should probably be you. So it's just 1 and 3, right?
Yeah, he just has 1 and 3.
Can I ask a quick question? Can I ask a quick question? Can I ask you a question? I know you're hearing in your earpiece too. Oh, speak on this side. Will you be asking the questions to us?
I'm sure you receive questions that you
Yes. You'll be the one
Kind
asking.
of.
Okay. And should
just use your mask.
Okay.
yes,
Okay.
that's right. And my question is actually, when we respond, should I look at you and respond,
Are they all-
or look to the camera and respond?
You need to try not to focus on it.
Okay, don't focus on me.
90% of the time should be,
But when I'm responding to your question,
but you can.
Okay.
I'm happy
Yeah.
to do whatever you like. I just wanted to know what works
Yeah,
better.
try to figure out. Yeah, you can move around once in a while. You look at the camera.
Yeah.
Just don't make it 100%.
Okay.
Because we're trying to engage with an audience. As
Yeah. This is your expertise, that's why.
Yes, I can hear you now.
The what? The names? Yes. Camera 2.
Brian Baker. Dr. Brian Baker. That should be you.
That would be me, yes.
Okay. No, because we're checking names and spellings. Why are those other little thingies so small?
No, I think Shapumba is here.
The what?
Oh, no.
Oh, okay. So that's Dr. Brian Baker, Country Director, Center. I can't see in front there. Good afternoon, Minister. How are you?
Good afternoon.
No, we are well. Center for Disease Control. Is that spelled properly?
And prevention, yes.
It's close.
It's correct. I think
It's
it's fine.
centers. There's a-
Centers with an S.
Yeah. For disease
Mwaka,
control.
it's multiple centers with an S. Yes.
Yes, good afternoon. Good afternoon.
Good afternoon. How are you today? Hello. I'm speaking again. Hello.
Yes, I can hear you. I have been humming. You told me to hum. I was humming the whole time. I am saying something right now. Yes. So until when do I keep talking? Because now I need to start figuring out when I need to stop talking. Is it fine for Matthew? What? No, Matthew was busy with something. Can we have centers? Centers.
One,
Yes,
two,
it's
one,
multiple
two.
centers.
Fandu,
That's
you
fine.
good?
That's fine. Next, we have Ms. Petty,
Yes, ma'am.
Shaimba,
Yes.
Osherero,
Share.
Acting Director, Directorate of Special Programs
Yes,
at the Ministry of Health. That is fine.
that is correct.
Programs. It's plural. It's plural now, so it's programs. There has to be an S.
Yes.
Bwaka? Please ask Matthew till when am I supposed to keep talking because I've run out of words to say. Okay. So is he done with my talking? Okay. The next, it's Mr. Nicolaus Shapumba, National Immunization Program Officer. Okay, yeah. Okay, now I get it now. National Immunization Program Officer, Directorate of Primary Healthcare Services at the Ministry of Health. Both ministers are here.
Hello.
Good afternoon,
Good afternoon.
ministers.
Good afternoon, Honorable.
Yes. We've got the cabinet briefing as our minister. No, our minister. Oh, yes. Mwaka. We can hear you. Helene, tupa malimba ya posa. Magianje, ponasha. Okrima. Oh, pura kujana. Mwaka. How many minutes do we have? 4 minutes. 4 minutes. We've got. Okay, no, it's fine. We've got 4 minutes left, and one of the people are not here. But Mwaka. I don't know. Tell them that they're too loud. We can hear them from here. I think Ronnie is going to tell them. Topo. Yeah, but don't. Yes, upona. John? Ronnie, I think the person is still coming at some point. He's not coming. Okay. You're removing the wrong chair. Never mind, under the circumstances. Yes.
Would you like us to pick up his questions? Would you like us to pick up his questions?
Pardon?
The questions that are assigned to him, we can assist with.
Okay, okay.
Yeah.
Okay, Mwaka, which do I do? So I can share them evenly between the two of you.
Yes, I can do the first one,
Okay.
and I think Ms. Petty
I'll
can
do
do
number three.
number 3.
You can do the second one.
The third one.
I think there's only 2 that have his
Yeah,
name on.
yeah.
Trying to make your job easy.
Thank you. Because I'm actually sitting here and trying to figure out how I'm going to play it. Good afternoon, Namibia and the world, and welcome to another session of ours here at the Government Information Center. I am your host for the afternoon, and my name is Shianwa Desire Kahiha. Today we are launching something. I love launches. And this is the Ministry of Health, who is launching something quite special to try and create more awareness on a health topic that is quite pertinent at the moment in the country. But before we do that, we would like to call on Honorable Pea Moshelenga to give us the cabinet briefing for this afternoon. Good afternoon, Honorable Minister. How are you today?
Thank you very much, and a very good afternoon to our viewers and listeners. I'm going to deliver the decisions of the first cabinet meeting that was held on the 13th of February. First decision. Report on the 2021 Livelihoods Vulnerability Assessment and Analysis. Cabinet takes note of the report on the 2021 Livelihoods Vulnerability Assessment and Analysis and approved the extension of the drought assistance to Kunene region, parts of Msati and the Rongo regions, from the 1st of April 2022 to the 30th of June 2022. And Cabinet directed the following offices, ministries, and agencies to continue with the implementation of safety nets in their areas of responsibility and in compliance with the Presidential Directive on sourcing local products and services as reflected as follows. Ministry of Education, Arts and Culture, School Feeding Program. Ministry of Gender Equality, Poverty Eradication and Social Welfare, Food Bank Program, and the marginalized communities. Cabinet directs Ministry of Agriculture, Water, and Land Reform to embark on continuous monitoring of the food security situation and strengthen efforts to increase food production. Second decision, report on the 9th session of the Intergovernmental Commission on Trade and Economic Cooperation between the Republic of Namibia and the Russian Federation, held on the 9th of December 2021 via virtual mode. Cabinet took note of the above-mentioned report and directed the following officers, ministries, and agencies to take action in the areas of responsibility as follows. Ministry of Industrialization, Trade, in collaboration with the Namibian Investment Promotion and Development Board, to host the Namibian Russian business-to-business virtual meeting in 2022, and for the Namibia Investment Promotion and Development Board to provide a report on ways to increase economic activities and cooperation between Namibia and Russia for their consideration by Cabinet by the end of March 2022. Ministry of Mines and Energy to draft a memorandum of understanding on capacity building and receiving scholarships from Russia to train Namibians in the sphere of the use of nuclear energy for peaceful purposes, and provide the federal government of Russia with a list of ongoing or pending hydropower and renewable energy projects in Namibia, as well as proposals on the possible participation of the PJSC Rasidros Design and Engineering Institute in hydrotechnic and infrastructure projects in Namibia, and provide a list of specific projects in geological surveying. Ministry of Fisheries and Marine Resources to resend a request for their import compliance certificates for fish and seafood processed meat products. To request a list of potential Russian companies that would be interested to import mariculture products from Namibia. And discuss mutual cooperation in the field of fisheries, including scientific cooperation between the corresponding institutions of the two countries, establishing conditions for investment into Namibia fishing industry, as well as cooperation in training and professional development of personnel for the Namibian fishing industry at the forthcoming session of the Russian-Namibian Joint Fisheries Commission. Ministry of Agriculture, Water and Land Reform to provide a list of companies interested to trade in agricultural products for mutually beneficial cooperation in the field of agro-industry, be it for export or import purposes. To send an official invitation to the Russian party to visit the Namibian institutions dealing with import and export compliance regulations. To invite the Russian government to participate in various fairs conducted at national and regional levels, such as the Windhoek Industrial and Agriculture Show and Ongwediva Annual Trade Fair. Ministry of Works and Transport to provide the Russian government with a list of specific joint projects to develop railway and urban rail transport. Ministry of Higher Education, Training and Innovation to identify a responsible executor for the Russian Africa Network University in consultation with the University of Namibia, and follow up on the pending Memorandum of Understanding in the field of technical and vocational education and training. Ministry of Justice to follow up on pending treaty on extradition. Ministry of Finance to follow up on the pending agreement on cooperation and mutual administrative assistance in custom matters. Ministry of Health and Social Services follow up on the pending MOU on health matters. Ministry of Education, Arts and Culture follow up on pending MOU on cooperation in the field of culture. And Ministry of Industrialization and Trade follow up on the pending MOU on cooperation in the field industry. Third decision, update on the transition of the food bank program to a conditional basic income grant, BIG. Cabinet takes note of the progress made towards the transitioning of the food bank program to a conditional basic income grant. The transition from food parcels to cash for food bank beneficiaries will begin in April 2022. Beneficiaries will be paid an amount of $500 per household per month given to the head of the household. Fourth decision, request for Namibia to accede to the G20 Compact with Africa. Cabinet approves in principle for Namibia to accede to the G20 Compact with Africa and authorizes the Minister of Finance to formulate and tender the government of the Republic of Namibia's expression of interest to join and engage the three-step process to complete Namibia's accession. The Minister of Finance should further submit the copy of the expression of the World Bank and International Monetary Fund. Cabinet directs the Ministry of International Relations and Cooperation to instruct ambassadors in Namibia with representation in the G20 member countries to hand over and be informed of Namibia's intention of joining the G20 Compact with Africa. And Cabinet directs the Director General of the National Planning Commission to establish a national compact with the Africa team to meet regularly to guide the accession process and monitor the implementation of the agreed steps and reform measures to be implemented. Here ends Cabinet briefings, and I thank you.
Thank you very much, Honourable Minister, for that Cabinet update for the afternoon. Definitely informative, and I see you were very busy. Our leaders were quite busy so early in the year. Thank you very much for coming through. We would also, in the same breath, like to welcome Dr. Kalumbi Shangula. He will be giving us the COVID update for the afternoon. Good afternoon, Doctor. How are you?
Thank you very much, moderator, esteemed panelists, fellow Namibians, good afternoon. I present to you the COVID update for the 16th of February 2022. We have received 1,490 first-time results from the laboratory in the last 24 hours reporting cycle. And out of those, 45 have tested positive for COVID-19, representing a 3.0% positivity ratio. Out of the 45, there are 41 new cases and 4 reinfections. The sex distribution is 24 males and 21 females. The age range from 10 months to 90 years. They as follow. Erongo, 10, with Wolf's Bay and Swakopmund having recorded 5 each. Chodandupa, 7, all from Chivarongo. Kavango East, 5 from Rundu. Omsati, 4, 3 from Oshkuku and 1 from Tsande. Komas, 4, all from the Windhoek district. Wangwena, 2, 1 each from Enana and Engela. Oshana 2 from Oshakati, Kunene 2 from Apuo, Omaheke, Zambezi, Oshikoto, Hardap, and Karas. 1 each from Kobabis, Katima Mulilo, Omthia, Mariental, and Luderitz, respectively. Among the confirmed cases, there are 7 learners and 5 teachers. 7 cases are fully vaccinated, while 38 are not vaccinated, constituting 84.4% of the total confirmed cases. 162 cases have recovered from 7 regions as follows: Kavango East, 108, Oshana 21, Hangwena 16, Maheke 12, Zambezi 2, Karas and Komas 1 each. Number of active cases is now 2,568. 63 are currently hospitalized, and 6 of the hospitalized cases are fully vaccinated, while 57 are not vaccinated, constituting 90.5% of all the hospitalized cases. 3 cases are in intensive care unit, of which 1 is fully vaccinated, and the remainder 2 are not vaccinated. We are reporting 1 death from Engela district, that of a 42-year-old male who died in the health facility on the 12th of February 2022. The deceased was not vaccinated. By the 15th of February 2022, a total of 427,892 people aged 18 years and above have received 1 dose of COVID vaccine, representing 29.1% of the target population. A total of 120,835 have received the Johnson & Johnson vaccine, while 247,679 adults have received 2 doses of the other vaccine types. Hence, 368,514 adults have completed the vaccination schedule, translating into 25% of the adult target population. 8,433 children aged between 12 and 17 years have received 1 dose of Pfizer vaccine, representing 2.7% of the target population of that cohort. Of these, 1,493 are fully vaccinated. The cumulative number of people vaccinated with the first dose of COVID-19 for both adults and children is now 436,331, of which 370,007 are fully vaccinated, translating into 20.8% of the target population. 22,762 people have received a COVID-19 vaccine booster dose. In summary, the total number of newly confirmed cases, newly confirmed individuals since the beginning of the pandemic is 156,913, together with the reinfections, gives us the total number of 158,974. And out of those, 152,394 have recovered, giving us a recovery rate of 97%. Since the beginning of the pandemic, a total number of 3,669 individuals have succumbed to COVID proper, and 328 have died as a result of COVID-19 related illnesses. Therefore, the total number of people who have died associated with COVID-19 is now 3,997. We have tested samples so far totaling 942,414. The total number of people currently in quarantine facilities stands at 317. This concludes today's COVID-19 update, and I thank you, moderator.
Afternoon. The numbers sound very good, but we do need to be very vigilant and continue to practice the necessary precautions to make sure that these numbers continue to go down. And that includes washing your hands regularly with running water and soap, making sure that you disinfect the surfaces that you're working on. You need to make sure that you sanitize your hands continuously or frequently, and also, most importantly, make sure that you practice the social distancing that has been put in place. As I said, that this afternoon we are busy with a launch, and the Ministry of Health and Social Services in 2021, on the 19th of April 2021, they launched a national campaign for the COVID-19 vaccination. And in their circular of 53 of 2021, it was classified that people with comorbidities to be a priority population, as they are at higher risk of getting severe COVID-19 disease. And if the daily COVID updates are anything to go by, this has definitely proven to be true. But this afternoon, we do have experts in the industry who will be helping us to dissect and understand what is comorbidities and why are the people with comorbidities at higher risk than other people of, being diagnosed with a severe COVID-19 disease. And also, as I said this afternoon, which is the most important thing happening today, it will be the official launch of the COVID-19 vaccination videos on the importance of vaccination amongst people with comorbidities. But as I said, in the studio, we have two experts, and we have Ms. Petty Shaimba. She is the Acting Director in the Directorate of Special Programs with the Ministry of Health and Social Services. Good afternoon, Ms. Petty.
Good afternoon, ma'am. Thank you for having me.
Thank you for being here. We also have Dr. Brian Baker. He is the Country Director for Centers for Disease Control and Prevention in the country. Good afternoon, Dr. Baker.
Good afternoon.
Thank you for being here.
It's a pleasure.
I think kicking it off with you, it's very simple. People want to know, what are comorbidities? And when we're talking about people with comorbidities, what are we referring to? And what do you need to pay attention to them?
So comorbidities is a term that we use in medicine to refer to multiple medical problems. So for example, someone might have diabetes and HIV and hypertension or high blood pressure. So taken together, that means from COVID-19. And that's what makes this topic today so important.
And also, I think it marries into the next question that we have. Maybe Dr. Baker, you can also just give us an answer to that. Are COVID-19 vaccines actually safe for people with comorbidities?
Absolutely. Not only are they safe, they're effective. As I mentioned, people with comorbidities are those that are most at risk of having something bad happen to them when they get sick with COVID-19. And it's been shown that vaccines make a dramatic difference in reducing their risk of being hospitalized, reducing their risks, of course, of dying. And we've seen from the Honorable Minister's data that he presented today that among people who are vaccinated, it's extremely rare, actually, to become very ill, and of course, extremely rare to be among those who died. So vaccines are not only safe, they're absolutely critical in this particular group.
Okay. I think we have gained a bit of not a bit, we've gained a better understanding. And I think most of the time, especially over the past 2 years, we've been hearing about comorbidities without really understanding. And I believe a lot of people started feeling a bit discriminated, and also it drove fear. I think that was the biggest thing here. It drove so much fear because of the lack of understanding. Ms. Shaimba, we would like to come to you, and we would want to understand what modalities has the ministry put in place to ensure that people with comorbidities are vaccinated?
Thank you so much for that question, and it is indeed an exciting day for us. So the ministry has together with the CDC, the Centers for Disease Control and Prevention in the country, we have trained healthcare workers in terms of the guidelines for the COVID-19 vaccination. And in addition to that, we have also developed IEC materials so that people can get more information about what exactly is COVID-19 vaccination in regard to people with comorbidities. And then we have also, very importantly, I feel that we have integrated COVID-19 vaccination within our chronic illness settings at our ART's clinics. So when you come for your ART, we are also able to provide COVID-19 vaccination.
Wow,
Yes.
wow. I'm loving the strides that are being made to try and ensure that these people have access to the vaccination. And that's when they choose to get vaccinated, at least there's not going to be a struggle for them to do so. As we said, for those who are only joining us now, this afternoon we are launching the official, it is the official launch, pardon me, for the vaccination videos, the COVID-19 vaccination videos, for the importance of vaccinations for people with comorbidities. It is a national discussion, as we all know that COVID has impacted all of us in one way or another. So be reminded that you can communicate with us through our social media platforms. On Facebook, we are at the Ministry of Information and Communication Technology, Republic of Namibia, Ministry of Information and Communication Technology, Republic of Namibia. That is our Facebook handle. And on the YouTube, our channel handle there is MICT Namibia. MICT Namibia, that is our YouTube handle. You can communicate with us if you have any questions to the panelists in the studio at the moment. If you want to get answers to understand something that you don't really understand so well, you can definitely come through through those platforms. This afternoon, we do have two panelists. As I said, we have Dr. Brian Baker. He is the country director for the Centers for Controlled Diseases and Prevention. Pardon me, did I muffle that up?
Pretty close.
I believe I muffled it up a bit. It is Centers for Disease Control and Prevention, pardon me. That's Dr. Brian Baker, he's the country director. And we also have Ms. Petty Shaimba. She's the acting director in the Directorate of Special Programs with the Ministry of Health and Social Services. That was just to welcome you if you're joining us now only. And we continue with the questions that we have to try and gain more understanding with regards to the topic at hand. And Dr. Brian, we would want to know from your side, what can CDC and the world basically, because it's a global problem, it's not just a Namibian problem. What can CDC and the world do to support people with comorbidities and also just to help them to have a healthier lifestyle?
Thanks. And I think that there's a lot that CDC has done globally to assist governments in their respective countries. You know, here efforts to support this and other populations are led by the Ministry of Health. And as Ms. Petty mentioned, they've made remarkable strides in trying to improve access of vaccine to people with comorbidities in ways that makes them easily accessible. However, sometimes it's just not enough to simply provide access to vaccine, because remember, People with comorbidities, that means they have other medical problems. So we have to work together to ensure that they have access to the medications and medical care for those other medical problems. We can do this through things like giving them longer prescriptions and medications so they have to come into the clinic less often, or just generally making it easier for them to continue their care. Other things we can do to particularly support this group is messages that are specific to them, just like we're talking about here today. Because everyone's different, and where you're coming from will really determine whether or not you have the right information to make good choices for vaccination. The other thing we can do is to let this group know that the other protection measures are really important, like hand washing, mask wearing, distancing, avoiding crowds. Those are all things that can help. The one last thing that I think is really important, that sometimes we forget, but perhaps is most important, is that all of us know someone who's older or has comorbidities and medical problems, and we can do our part to help protect them by getting ourselves vaccinated, by talking to our friends and loved ones and giving them accurate information so they can make good choices. All those things together really can help support people with comorbidities and allow them to live longer and healthier lives.
Yeah. While we can all do our part to try and assist in this matter, not all comorbidities are a choice, and not all of them are caused by bad habits or bad lifestyle activities that we engage in. So honestly speaking, across board, we need to learn to be humbled around people with comorbidities, to be supportive, and to actually also partake in the activities that could enhance their roads to healthier lifestyles, especially during a time such as COVID, where as we noticed from 2019, most of these deaths were amongst people with comorbidities. Remember, we said that it's a national conversation. You can join us. Our call-in line, it is 061. That is the area code. 061 is the code. The number is 400-397. 400-397, that is the number here. We also have an audience with us. As we said, it is a launch. So if we have anybody in studio who is interested in asking a question, you are welcome to approach the podium and just place your question to the panelists, or even a comment. If you need to add a comment, maybe something that you feel that could actually be beneficial for the audience to hear it. So we continue with the questions that we have, and we would like to ask Ms. Petty Chamber. We understand that the Ministry of Health has produced these videos that we're launching today, and they're targeting people with comorbidities. Take us through these videos. What do they contain? What is the content thereof, and what is the aim, basically, with the videos themselves?
Okay, I just want to reiterate on what you said, that we know that we lost a lot of our family members, our friends or colleagues with comorbidities due to COVID-19, and it created a kind of fear on the people living with comorbidities. So what we have done, we have produced these videos in collaboration with the CDC Namibia, and these videos have been filmed in the Ohangwena region, in Zambezi, in Kunene, in Hadap region, as well as Commerce region. So the actors are from those specific regions that I've just mentioned. So these are people that feel that they've got this message that they want to put across to to try and help somebody out there. So these videos have a specific message, and the message is simple and clear. It's even if you have a comorbidity, COVID-19 vaccination is still safe for you. So that is the message, that is the key message that the videos are trying to put across. So it's a good thing because it's being filmed by people from the local settings. So it kind of speaks to the people on the ground. So that is what is in our videos. Yes, so that is what we are going to launch today.
Okay.
Thank you.
It is a message from the people to the people, basically. It's a nation trying to help its people to get a message through to try and make sure that we minimize, if not eliminate, any deaths that are caused by COVID-19, especially amongst people who are living with comorbidities. As we are reminding you, we are available on our social media platforms. You can communicate with us if you have any questions. On Facebook, we are at Ministry of Information and Communication Technology, Republic of Namibia. That's Ministry of Information and Communication Technology, Republic of Namibia. Our YouTube channel handle is MICT Namibia. That is on YouTube, MICT Namibia. Our call-in line is 061 400 397. 061 400 397. Dr. Baker, I'd like to find out from you, especially from the platform where you sit at, that's CDC. It's, you know, as much as we have a representative in every single country, you've got global connectivity. Here we've got the Ministry of Health trying one approach to try and, you know, put the message out there, create awareness. But we would like to find out from you, there has been a lot of myths and misinformation going around with regards to the effects of vaccine on people, especially people with comorbidities. How have you tried, through your organization, through your platforms, through, you know, the various attachments that you have, try to debunk these myths?
So I think that the past couple of years of the COVID pandemic have been especially challenging because of so much change. This is, of course, a new virus, but also a new vaccine. And with all of that comes a lot of questions. So I think our job at CDC is to help provide the best factual information and science, and then work with, of course, host governments to get it out to the people that live in those countries. Every country is a different culture and a different environment where the messages are shared best in different ways. One thing we like to say is that all public health is local. And the idea is that, you know, one can't sit in an office somewhere and determine what's best for people in their town or village. That it's really people themselves and their communities that determine that. So I think one of the keys that we've seen being universal about getting accurate messaging out there about how safe and effective vaccines are is really empowering and facilitating local leaders. And that anyone can be a leader. Just as a member of your community, as a member of your family, as a member of your workplace, you are a leader and have the opportunity to share good information with others and really help them to make good choices for themselves and the community at large. The one last thing I'll say is that this vaccine, despite it being new, has been given to billions of people worldwide. This is among the most studied and well-monitored vaccine in the history of mankind. So we can say with great confidence that it works, that it saved lives, and that it's safe.
Okay. As Dr. Baker is saying, honestly speaking, sometimes driving misinformation and myths actually makes the situation worse. And at the end of the day, only us as a nation will suffer because we are the ones that get affected. We lose working class people. We lose our parents. We lose our children just because of things like misinformation and myths. Ms. Shaimba, we'd like to come to you and we want to find out, with the launching of these videos today, what platforms or strategies will you be using as a ministry to try and spread and disseminate the information of these videos?
Well, so we have envisaged that we are going to use platforms, social media platforms. We have the Facebook, the TVs, the Twitters, and we would like to use this opportunity also to call upon the community members to try and share these videos on their platforms, on their pages, and then we are also requesting the private companies as well as the public offices to just whenever they find time, whenever they can, they try to share these videos so that they can reach out to all the corners of the country. So just to also remember that these videos are not only specifically for people with comorbidities, they are also in a way targeting the general public. So we'll use social media platforms and as well as all those health facilities, private and public, and those are the platforms that we envisage. And we are just calling on everyone to use the opportunity also to share these videos on their social media pages.
Okay,
Yes,
okay.
yeah.
So it's quite clear here that as much as it's the Ministry of Health that came up with these videos in collaboration with the CDC, it is very much us as a nation who need to assist to be the vehicle that drives the awareness, that pushes the videos to go out there and reaches the most remotest of areas. I know somebody who knows somebody who knows somebody else. So I think that is the basic.
And tell a friend to tell a friend to
Yes,
tell a friend.
I think that's the basic channel we're trying to use with this. But these first need to be launched, and it's not my baby. So I'd like to call upon the two of you to do us the honors to launch these videos for us this afternoon.
So
you can sit where you are, and
okay,
we just allow our viewers.
yes, so at this moment, I would like to take this opportunity. It is indeed my honor to thank all the stakeholders that were involved in producing the videos. I would like to thank, in particular, the CDC, the Center for Disease Control and Prevention in Namibia. And I would like to also thank all the other development partners, and not forgetting the individuals who filmed the videos. These are very important for us, and not leaving out the healthcare workers in the country. We have been working with healthcare workers in our HIV response. So I would like to really acknowledge everyone that played a role in making these videos a success, and that today we are excited to really say that we are finally and officially launching these 5 videos. I thank you.
A new day has dawned upon us. One marked by great loss and pain. But there is a way. To mitigate and curb the effects of this new and harsh reality. One that requires the collective bravery, participation, and the unity of the Namibian people. From all the 4 corners of this contrasting and beautiful land, only then will we have a real fighting chance to rebuild our sense of livelihood. COVID-19 vaccines are safe and effective for everyone, and to people living with chronic illnesses such as diabetes, high blood pressure, HIV, cancer, and epilepsy.
Tôi muốn ơi xin là tặng ngoát mà maditani sin maditani di tai e. Chỉ sự có bây giờ hóa hun hóa na, ui cú si sinh cú hóa hun, na cái không ngã ha, hú cú ngã, chỉ hóa cú vậy mà bà si. Ai bây giờ đã kêu cái ngay này bà sa, đi si cam à khơi đara ha, deri ta. Tidak ke diri dah siha, tidak ke rang anu, tidak ke ni sang anu si uha. Sekolah tuan ke kadi ha, kat tuan rodi kira sekolah ta, cincin ha udah kon udah ke he, tada ni kau ni si sang arang, tada ni kau ni mai wasi, ada si kasa pan au tertomi si, ni kroni sing ainin cin ke, sanse Tok kara ini di kasha, tidak kami tidak kisi kasha Khabar ke eerlijk te wees. Het is zeker niet eens een seconde niet aan mij, maar kasta na drepros na drepesa. Chits kusat sang anu chuko toa. Chits ko toa khabitske rara. Spijt ko hain kas na hong atma. Ndegi ina khu hong atma ne kasha.
Dat die inligting wat ek het, is dat die inenting heeltemal veilig is, al is jy 'n bloeddrukleier. Al het jy kroniese siektes, gaan hierdie inenting jou eerder beskerm as wat dit jou gaan benadeel, want dit maak jou immuunstelsel soveel sterker om teen hierdie virus te veg as wat jy nie ingeënt is nie.
COVID-19 vaccines are safe and effective for everyone, and to people living with chronic illnesses such as diabetes, high blood pressure, HIV, cancer, and epilepsy.
Okuja oji mwetambuko mujize bya mwetemu mbu wa corona. Mujize mbo oji twakonyiso kuja julule atuvu kuja muno venda amirutenga tengo jino mujize wanje mbumba utambunjika nao vero mujize mbintu bavera omukuru mujika nao ngana inyuma opera mujize mbintu o winambi mituzo kuja omujize junu mujize wombintu kuzo kuvendwa ovendo corona obize borobi okuja ke hiyo mujize corona juwe yana hii amemba muno ovenda ndo corona avehemba bavendwa mbamana ya amijo mundu ngumba ya mu mutima mu mujize corona vandu vingi vata vingi ve mapangwa hupa mujize mbaka uno jinda juungula ovenda kaina jinda kai hiyama o mujize ovendwa uli opewa mauva okapewa mwele walwe ovendwa no amwami ngona inji wanje no jinji wamira iza mujwano kuja mundu mozo kuvendwa opangwa overu kapo jidivi zimira ile jwana jitu imbi wama yungulizi wamu chuno mbindu jinga wavendwa mungoka obize amimbavera rukuka nayi meindi nondi amuyaveru mundu okuveru mujizo mbindu andwe jime wama yavere nayi mbavera rukuru wami mbavendwa nayi ngunde enji wanje beramba ovenda ndamba man.
COVID-19 vaccines are safe and effective for everyone, and to people living with chronic illnesses such as diabetes, high blood pressure, HIV, cancer, and epilepsy.
Ndinonge sefa yange handilongele kenana oka bisini sango kange kashona andila ndifango enhaku ni tolo ufengo no madi ndelo bisini sango kwalingo haende na wanale pefimbo lokolona inayuya ndele pefe shokolona ya obisini sange oyashuna pedo ondahala ne bakwetu tukufenyo nhatu opo tukufenyo matokolo nonkumo tuyeni ko ipangelo tukatuninweni otunila yo COVID-19 ngasinga mewe ipopyapa ondatunilwa nale nokuli evenda danga dishonde dimanako ndengenda tuninwe evendayo inandimona mona ndupyaka diwashanga shanta popi ondahala ngo kudenga unene onfindo kucha otunila yo COVID-19 oya kwatela monana obanu abesha babeno mikifi kese uli molutuloe ngengo watunilwa oshayela kucha ngaho oba kweita bolutuvoye oba pewe nkono nandengeno ukakalene wakwatwako kombuto yo COVID-19 iteikunate povalinga ashiwinya natunilwa shosho ne oshima tashiyanjwa kucha tuyeni tukatunilweni opo tufika mifeipo bakweita vetu vomalutu etweni.
COVID-19 vaccines are safe and effective for everyone, and to people living with chronic illnesses such as diabetes, high blood pressure, HIV, cancer, and epilepsy.
Working for a public entity like Namibia Training Authority requires that we have stakeholders, and these stakeholders include government, ministries, regional, local authority, and the local community as well. Now, having interaction with all these stakeholders and going through this pandemic of the coronavirus, I felt strongly that I go for the coronavirus vaccine. I'm a hypertension patient, BP, and because of that, that also increases the risk of having the COVID-19 and even serious complications if I contract the virus. And that's why I personally decided that I must get vaccinated. I was first vaccinated with the first dose on the 17th of June, and on the 18th of July, I got my second dose of the Sinopharm. That as I stand here, being a patient of BP, I'm fully vaccinated. Till now, I have not encountered anything, any side effects that would make my work, whether it is official or private work like this one. I do not have anything that would stop me from doing my work. And for keeping me alive, I can only thank God for the vaccine that has come that can keep us alive, that today I'm still able to tender for my family, and I'm still able to take care of my workers, and those workers also have families.
COVID-19 vaccines are safe and effective for everyone, and to people living with chronic illnesses such as diabetes, high blood pressure, HIV, cancer, and epilepsy.
There we have it. Those are definitely touching videos, and I think the nice thing about it is it was done by locals, and it touches the heart. One can actually connect also, especially with the fact that it's from experiences, their personal experience, how they feel, and what took them to that point of getting vaccinated. So the ball is now in our court. We need to now further drive this message. Before we close off, Ms. Shemba, any last words?
I just want to thank you for this opportunity, and as I said, it's a very exciting time for us, and we just pray that this would be taken forward. And the message is COVID-19 vaccination is safe for everyone.
Okay.
Thank you.
Thank you. Dr. Baker, last words.
I just to say that to encourage all of your viewers to share these videos widely. As you said, these are the voices from communities in Namibia, and this is from people who are just speaking to their own experience.
Yeah.
And together we really can make a difference in saving lives and preventing more deaths from COVID-19.
Yeah.
Vaccination is the tool that we have.
Yeah. Okay. There we have it. Thank you very much for joining us this afternoon, whether it's through your Facebook page, whether it's via your telephone device, whether it's a radio station, and also to those who were able to make it to be with us this afternoon in the studio. Thank you very much for taking out the time to be part of this launch and this experience. From myself, Shianwa Desire Kahiha, would like to also say thank you for taking the time out, for watching us and being part of the conversation. We'd like to thank the panelists for also making the time out to be here with us. From the production crew and myself, have a good afternoon. Until next week.